So hi everyone, today we're going to demonstrate how to put sterile gloves in a sterile manner. Usually those are used for sterile procedure as dressing changes, urinary catheterization, etc. There's different size for for sterile gloves, so you have to make sure that you have the proper size when you go. When they're provided in a kit that you're using, if you know that you need extra large glove or extra small glove, make sure you bring a pair with you because usually those provided in the kits are medium size. So before you start, make sure you perform hand hygiene and make sure you let the alcohol evaporate completely, because if your hands are wet, it's going to be much harder for you to actually put on your sterile gloves. Also, make sure that your working area is clean and that the table is at your waist level. Okay. Now, you can start by opening the package. On the top one, it usually opens easily. So you can open it that way and take the inside package. Now, once they're in there, they're still wrapped properly so you can touch that inner package. Now, when you open it, you want to make sure you fold back the top and the bottom part to prevent them from falling into your field afterwards. So take the time to really open them properly so you're not going to run into trouble after, like this. Now you can slide your fingers underneath those two little flips here and open them carefully. Again, make sure you fold all the sides so they don't fall back onto your sterile gloves. If you touch here and this falls, you're going to contaminate your gloves. So make sure that if they do fall, if you had touched this side previously, you have to change the whole thing because you contaminated your gloves. So now that they're open, you can start with the left or the right hand. It doesn't matter as long as you're comfortable and as long as you stay sterile. So the first glove that you're going to put, you can only touch the inside of your glove, so the inside of the cuff. So you can grab your glove, you can step back a little bit to prevent your glove from touching the table, okay? So you grab the cuff, you can put your thumb close to the other fingers, it's going to be easier to insert, and then you push it in. Again, you're only touching the part of the glove that's going to touch your skin, so the inside of the glove. That one. For the second glove, you want to slide your fingers underneath the cuff. So your glove is actually touching the outside of your glove, which is fine because your first hand is sterile. Same thing, you put your thumb close to the other finger and you slide your hand in. At this point, if you're having trouble, it's okay because you're going to be able to use your hand after a while to position it like this one. Now I'm all stuck. So you can grab the inner part, not the inner part, but this part of your glove and slide it down because everything is sterile on this side. So now your two hands are sterile. Your paper, you can choose to leave it on the table. You can move it with your elbow if you want, but it's easier if you just leave it like this so you won't contaminate yourself. One thing to know, don't put your hands below waist level because once they're out of your vision, you cannot confirm that they're still sterile. So for us, as soon as your hands are below your waist level, so if you grab something and put it in the garbage, they're below waist level. So we consider that you contaminate yourself. So make sure they're above your waist and that you can see them at all times. Thank you.